Hi, everybody. I'm just going to get it started. I think somebody's video is turned on. All right, I'm going to start sharing my screen, and we'll go from there. Once again, my name is Ramki. I'm a physical therapist, and I practice at RBA Physical Therapy. The main goal for today, while everybody is on social distancing and everything, is to educate or reinstate like the importance of posture. So I hope everybody can hear me. I'm just going to test it with Jay. I'm going to unmute him. So Jay, can you hear me?
Yes, I can hear you.
Okay, thank you. So the goal today is not about trying to teach too many things, but at the same time, I want from this session, people to benefit, at least, to look at the posture and correct it while they're working. With the current situation, with quarantine and stay at home, I know like we always appreciate all the frontline. I mean, once again, we take this opportunity to appreciate all the doctors, nurses, the ambulance people, ER nurses, everybody, and all the medical professionals who are working, to help all the COVID patients. But at the same time, when I look at the IT people, I mean, in the last 3 weeks with all the credit card transactions, I've never had a stop or anything. So hats off to you guys. I know you guys are working. I know a lot of friends from Capital One and Microsoft and everything. So thank you to everybody because it's the whole team that's helping each other. So we're going to talk about back pain in the end. Normally my presentation goes for treatment aspects. Like I said, this coming series of whatever presentations that are going to come in the next few weekends is all about education and what are the small things that we can do to avoid, going to ER and things like that. So we're going to start with, I know so many of you are working from home. We all think when we work from home, it's so ideal, but this was sent to me by one of my friends. Actually, he's online right now. So this was taken. If you really see his posture, how he's sitting, once again, everybody is trying to do their best at this time to get the work done. So this is one of the typical postures that you'll be seeing, when you work from home. The end result of it, somebody will say, I didn't do anything. I was just working. I have back pain. I have neck pain. I have, pain in my upper back and things like that. So the contents for the topic today is we're going to talk about what is posture. We're going to talk about back pain. Like I said, I'm not going to talk about the treatment options and physical therapy for back pain because I wanted to make it short and sweet for everybody. And I, once again, value all your time. And we will have questions in the end. So if you have any questions, just wait till the end. So what is posture? Posture is basically the position of the body in sitting, lying, or standing. So why is posture important? Basically, posture is important for so many reasons. It is the ease with which you can sit, stand, and lie down. So what is a good posture? Before that, I'm going to show you some more examples of how people are working at home. I have the boss here. So Lavanya, say hi. And see, she works right now more than what I've seen. I think, once again, like I said, IT professionals, HRs, everybody who's working from home, you guys are already working like 30% more than what you're used to when you go to the office. So a typical posture that we see is where the head is bent forward, your upper back is bent, you're sitting in a couch, one of the legs is bent all day, you know, or hours together. And this is a typical posture that we see. Or else somebody will be crossing their legs like this and work, or they put their laptop on the end of the couch and try to bend down and work. So avoid this. If you're doing this, please stop it, because these are some of the reasons you will have back spasms leading to pain, causing you a visit to go to the ER and or to patient first or any urgent care. Let's try to avoid going to those places right now. The reason is you don't want to be there. They don't have time for you. So what is a good posture? The ability to maintain a body in upright position with less energy spent is considered as a good posture. As long as you spend less energy, you're standing right here, less energy spent. Right now, all my muscles are like at good position and they're not, there's no energy spent. Instead, if I'm going to be like in this position, like this, my upper back muscles are working while I'm resting. You don't want to do that. You don't want to make it to go to spasm. Another example is an ability to maintain balance in an upright position by keeping the line of gravity near the center of base of support. So basically what it is you don't want to be standing like this or like this. At each position is 1 foot gap. This is the position you can stand. At this position, your muscles are actually working with less energy. So while we talk about spine, just to make sure your spine is all not straight as you think, there are 2 curves mainly, but at 3 different levels. Total number of vertebrae is 33. Your cervical is 7. It is in a cervical lordosis, which is about 20 to 40 degree curve, where your curve goes in like this, where your curve is like bent inwards. And then comes the thoracic kyphosis, which is about the next 12 vertebrae, and that's about 30 to 50 degrees. And then comes lordosis, where it goes in again, and that's about 30 to 50 degrees. These are the normal curves. But we are going to talk about what is abnormal and then try to correct that curve. So we're going to go ahead and see posture during activities, overview of correct versus incorrect postures. So how many of us catch ourselves doing, like, okay, if somebody says stand erect, we try to stand like this. Right here, if you look at my thoracic kyphosis, I'm actually trying to overcorrect it. That is not right, because my upper back muscles are working more. And right here, if I push it too back, my lordosis is getting flattened. I don't want to do that either. Our goal is to maintain your cervical spine, thoracic spine, and lumbar spine in a sync with their normal curvatures. So if you see the picture on the right, that is the Achilles position. That is the right postural position that we are talking about. When you're standing up, 1 foot apart, your neck is right there, like you're facing forward. Your cervical lordosis is maintained, your kyphosis is maintained, and your lumbar lordosis is maintained. At this position, you're not spending much energy. I will talk about sitting position and lying position in the coming slides. I'm not leaving those. So keep your spine straight, erect within the curvatures. Do not bend your back and balance your weight evenly on both feet. Yeah, we're coming for sitting posture. This is the most important key posture that I wanted to talk today, because everybody is working from home. All of us are in front of the computer. whether we do a lot of projects on computer or not. Even in my case, I have telehealth where I talk to people over the phone or a computer. So very important factor when you're sitting down, make sure your computer is at your eye level. Do not bend forward. Do not bend your spine. So the key elements. While I'm saying this, also add here, please try to stand up every 25 to 35 minutes. I say that as a magic time because even if you're correcting your posture, sometimes when you get into a call or when you get into work, you get so engrossed with the work, you forget your posture at that point. Please, please, please put an alarm on your computer so that you can get up every 25 to 30 minutes. Just stand up. I know I'm changing between 30, 35. It is up to you. Get up more often because that way you're not in one posture all the time. So the monitor, adjust the distance and height. The top of monitor should be at the eye level and slightly tilted. Arms relaxed, shoulders relaxed. Some of my friends who came recently, have told me so many things. Oh my, I have a pain radiating down my arm. The key factor sometimes is you're sitting and typing like this. Remember, when you are at your office, most of us, not all of us, most of us can request for like ergonomic desk and stuff. At home, we do not have that. So make sure your arms and shoulders are relaxed. The chair should have a backrest and an armrest and an adjustable height. Make sure your chair is very comfortable for you. You're going to be sitting in those chairs 10 to 12 hours or even 14 hours. Like I said, you're doing more than what you have done before. Your legs and thighs parallel to the floor. If you need a footrest, please get a footrest. Another important thing, a lot of times I hear people come and say, hey, I didn't do much, but I was just lifting a box. How we lift a box is very important. I don't want somebody, give me 1 second. So consider this as a box. I don't want somebody to go ahead and lift it like this and the box is here. Always, always try to make sure you get closer to the box or any object, even if it is light. Sometimes you'll be deceived. You think it's a light object, but it's more heavy. It's better to practice this all the time. Always bend down on your legs, except there are some exceptions when you have like knee surgeries and hip surgeries, but there also we can modify it. So when you're going to be getting something, make sure you're at ease position and you're going to bend down at your legs. Use your arms and your legs to lift the object, not like try to avoid much weight on your back. So you're going to go like this. Lift it up, make sure it's closer to your body. All right, bend your knees and squat. Use your muscles in your legs and arms, not your back. Keep items close to your body. Okay, another important thing, because right now, what we do is we all go for a good walk and stuff. Once again, it's not here you're going to walk. It's not here you're going to walk. Walk, make sure you're like looking forward ahead as long as your spine curves and everything is maintained. So if you see the third picture on walking, that's the key. And also running, always try to keep your body forward. Do not try to run with your back in extension. All right, a key element to walk and run. Basically, keep your head straight, balance forward while running. Target is 100 steps per minute. That's a target. We have amateur runners in this group, as well as we have, a good runner here. And one of the topics we'll be talking, my friend from UK will be presenting, Arun will be presenting on running. I think that's coming up in April 24th to 25th, something like that. We'll share the link soon. So once I get information from Arun. And bend one knee and in midfoot strike. So the most important thing I wanted to talk today, I know, friends, I'm putting it back, but I'm standing right now. Your phones, always when you're sitting, put it in the pocket or put it outside. Keep it beside you. Do not sit with your phone on your back like, you're going to sit like that. Every time you do that, you're actually, causing the alignment of your back to go away. So at that point, what happens is one pelvis is slowly starting to, be higher than the other one. You do not want to do that. That will cause your QL spasm, like back muscle spasm. You do not want that. So when you're going to be standing up and looking at, your phone, make sure your phone is right here. Do not look at your phone bending forward. At the same time, if you're going to be sitting on a couch and stuff, make sure your back is completely supported and your iPad or phone is at a good eye level. Do not try to bend down like this and do it, because you will start having neck pain. The first thing we'll hear is, oh, I didn't do anything wrong, but I'm having, spasms in my neck. You did something wrong because you're on your phone for 2 hours, bending, with your neck bent forward. So keep your neck curve aligned to spine, like we discussed. If standing, stand erect and slightly bend your neck. And while sitting, align your back and neck and rest properly while viewing your phone or iPad. Another important thing, sleeping posture. While you're sleeping, I'm going to grab a pillow, okay? Give me 1 second. While you're sleeping, make sure your pillow is completely supporting your neck like this. I don't want a pillow to be squeezed in because that will cause more compression on your neck. I don't want a pillow to be like this, where your neck is not supported. You will start having like wry neck or torticollitis just because you're starting to sleep like this. So try to put a pillow right there, align it. If one pillow is not sufficient, you can always, don't stack it up. You can always align another pillow here so that your entire neck is supported. And try not to sleep on your arms because you're going to compress your nerves on your arms. Try to avoid that. Another thing, I always have this question asked. When you're lying down on your back, it's the same exact thing. Your pillow has to support till your shoulder height. So like that. Not here, not here. It should support right here. Another thing is going to be lying down on your side or your back. What kind of mattress? It cannot be too soft, it cannot be too firm. If it is too firm, you might as well lie down on the floor. You don't want that. Except, once again, there are exceptions, but I'm talking about the 99% of the population. Always have a mattress that is comfortable and it is right firmness on it. So once again, choose the correct pillow, keep your neck and back aligned, choose the correct firmness that aligns your spine and back and neck. Okay, we talked about posture, lying down, sitting and standing. Why is it important? It is important, actually posture alone can alleviate a chronic pain. Suppose you have chronic neck and back. With good posture, of course, like I said, I'm not talking about the physical therapy part. With good posture alone, you can minimize your pain. It can increase your oxygen intake. Current situation, please do your breathing exercise, relax diaphragmatic breathing and all those things, because your oxygen intake is very important right now, because your lungs has to expand and relax. So reduce muscle spasm with a good posture, like I talked about it earlier. It will help you strengthen your core and it will promote weight loss. I'm saying this with the caption saying exercise is the key. All right. We're going to talk about low back pain. More than 3 million people in US alone are getting treated for back pain. once again, a sedentary lifestyle has been one of the key reasons, especially people working in IT. They sit for prolonged times. I'm not complaining, but I'm just creating an awareness. It is usually self-treatable, self-diagnosable. Lab tests are rarely required. Somebody to come and say me have back pain, I don't need an X-ray or scan for it, except if it is a chronic condition and they have more than just muscle spasm. So most of the cause is because a ligament strain or muscle strain, and other reasons are improper posture, improper lifting, lack of regular exercise, fracture, ruptured disc, etc. And the most common area is your low back pain and neck, actually. All right. What causes it? Like we discussed, the non-mechanical part, lifting objects, trauma, improper posture, frequent bending, doing something like here. And by the way, while I was talking on posture, please make sure your teenage kids do not have a curved neck or curved back, because all of a sudden they grow tall and they want to stand like this and they'll be on their phone all the time like this. The phone is supposed to be here. Parents, whoever is listening, please correct them. You don't want them to have a back problem as soon as they turn 16 or 17. And these are some of the back curves. I'm going to move the screen here. Okay. The person on the left that you saw, that's the normal curve. And these two are the normal ones. And then the kyphosis is right here where the spine is bent more. This is increased lumbar lordosis. And this is flat back where the curvatures are not there. Flattened back again. Sway back, increased kyphosis with your increased cervical lordosis. If you see the curve for neck is increased right there. And circular back and scoliosis. Most of the times why I say about the cell phone being here is because that will cause something called functional scoliosis when your pelvis aligns, improper. Lot of times that is the key factor for your muscle spasm. So usually when I see somebody, the first thing I check is their pelvic alignment, just to make sure the alignment is good. If not, work on it first. So once again, talking about the common conditions, muscle strain, bulging disc, sciatica, spinal stenosis, osteoarthritis, spondylosis, porosis, scoliosis. So common areas of back pain: neck, upper back, and lower back. And once again, I've put pictures of good versus bad posture. One of the common things that you can avoid arthritis is by maintaining a good posture, because in good posture, you're using less muscle energy. So that's also the key for it. All right, while we talked about all the postures and everything, I wanted to talk about some exercise right now that you can do at home which will help you relieve your back pain. The bird dog position, the first two exercises right here. This is the starting position. This is the ending position. You're going to lift one arm and one leg, at the same time while, the dog position. The only thing is, if your balance is pretty good, you can do it both on the same side. If you don't have good balance, start with opposite arm and opposite leg. That's usually easier. The next one is your thoracic extension. And the third one is standing hamstring stretch. Fourth one is cat-cow stretch. That is the only position because your spine, you're trying to hyperextend as well as increase your lordosis and relax. Increase and relax. And the fifth one is back extension. And the sixth one is knee to chest stretch. Any questions so far? I'm going to unmute everybody. Give me 1 minute, and then we'll go from there. All right. 1 second, everyone. Any questions?
कुछ तो पूछ लो ना, सात क्वेश्चन कुछ होगा तो अच्छा लगेगा. I mean that you are listening.
Guys, I've unmuted everybody.
This fish is not fresh yet.
Hey, Ramki, you might want to ask them to send the questions via chat. If not,
okay,
that will be better. And there are 3 questions actually, but I mean
okay.
three chat messages from you, but they weren't taken to the chat as.
Okay, I'm going to go ahead and mute it again then. If you want, you guys can unmute yourself. Let me give you the control.
इनको अंग्रेजी में बोल रिप्लाई करना चाहिए.
Okay, give me 1 second. All right.
Hi, Dr. Ramki. This is Rashmi. Actually, my question is, can we get headaches from bad neck posture because of sleeping in a bad position?
Because what happens is your both upper trapezius muscle go into spasm with a bad posture. Your sternocleidomastoid gets into spasm. So yes, you will have headaches. Yes.
Dr. Ramki, this is Divya. What about sleeping on your back? Is that, sleeping on your stomach, is that a bad position?
Actually not, as long as you can breathe well. Yes, no, you're good.
Okay, and how do you do the pillow position for that?
Basically, you're going to sleep with your neck turned to one side. Make sure your neck is supported while sleeping. The same thing, the principle is the same. As long as your neck is completely supported, your pillow should not be here. So if you're going to be sleeping like this, make sure you're going to rest like that.
Okay, cool.
Anybody else?
Hey, RK,
Hi, Ramki, this is Shamya.
Okay. Anyone, whoever wants to go.
Sorry, this is Shamya. Hey, Ramki, I have a question on the laptops. Laptops, when you use them, they are really not high enough in the,
Yes.
So, I mean, the screen is not high enough. So how do you manage that?
Basically, put a pillow underneath wherever you're sitting, or put some box underneath. Make sure they're at your level. Modify it accordingly, because you cannot bend forward and see it.
Okay, Kamish here. Just with the work stuff, right? We just get engrossed with the stuff, and then we obviously forget the posture. What is the easy way for us to ensure that we keep maintaining the posture?
The best thing is on your screen, like you have alert for all your appointments, keep an appointment for your posture every 25 to 35 minutes, so that it reminds you to stand up. Nobody is going to see your screen. That alarm is just for you. You can put it on your personal email app, or you can put it on your regular, whatever alert you have. I know I'm saying this for the last few years. How many people are doing it? Very rarely, but that is the key. If you do it for 3 weeks, eventually you'll automatically get a habit, and you'll start doing it without even an alarm. So the best key is, while you're working your work hours, there should be an alarm that says posture.
Hi, Dr. Ramki. I have a question. Most of the nights I'm having numbness in my hand, the palm. So is it some exercise for that, or?
Yes. First of all, correct your posture. Your numbness on your arms are coming from your neck. Some posture that you're doing, either you're going to be sitting down, or looking at the phone or your laptop, or watching TV, slouched down, neck bent. All those are the bad postures. That is what presses. So your brachial plexus comes on your C4 spine. That's where it comes out. you're putting more pressure on your C4 spine, causing it to go numb.
Mm-hmm.
Some of the stretches that you could do is make sure like you have isometric exercise. You're going to be pressing with your hand on the side of your head, whichever side is hurting. Do not let the head move or the hand move. Just keep equal pressure on the side for like 10 seconds and then relax. Do about 5 to 10 repetitions. Go forward, the same thing. Back, same thing. And on the side, same thing. Do not hurt yourself by doing this. This is supposed to be a relaxed exercise. Make sure that you're doing it relaxed. And always try to shrug your shoulders. You know, once again, take that 25 to 35 minutes on your screen, like put a pop-up. As long as that 35 minutes comes, you can stand up. You guys can roll your shoulders, lift your arm up, march in place, go back to sitting. Within within a minute, go back to sitting. That's fine. But you've already broken the posture time, you know?
Okay, thank you.
Yeah. Any other questions?
I've sent one in the chat, Ramki. This is Shamya.
I saw that. So Sham, answering your question, so I'll read the question out. If anyone who is pain-free with a scoliosis, but the client has frequent history of localized back pain, will you take scoliosis in consideration or just treat the issue? In all reality, yes, I will take the scoliosis in consideration, but I'll try to see first whether it's a structural scoliosis where it is already your spine is deformed, or it's a functional one. And an easy way to check the functional one at home, if you're doing it for your loved one or anybody, ask them to bend forward. If the scoliosis corrects itself, that's functional. I know I'm talking more technical terms here, but most of the times this can be checked. But if it is structural, we have to see if it is permanent or not. Once again, look at their habits, how they sit, if they're crossing their legs more often, or if they're going to be putting something on their back pocket, a heavy wallet or something, ask them to take it out. Things can correct. Like at least 50% of the problem will be solved.
Okay, so is putting like one leg on top of the other not good to sit? Like when you're sitting, is it okay to put?
As long as you can change your position within a minute, it is okay. But anything more than a minute, it's basically going into muscle memory. Your brain thinks that's a normal position, but the more you're crossing like this, one of the pelvis is always higher than the other. You do not want that. You do not want a simple problem, a simple cause causing a massive back pain.
Okay.
Hey, Ramki.
It's better to avoid it. Yes, sir.
Thank you for organizing this thing. It's very helpful. Appreciate taking the time and all this.
Oh, definitely. Please tune back in tomorrow. We're going to be talking about pain a lot. Manikanta Prasad, he's from Canada. And he's going to be talking a lot about, pain, what is pain and how to manage pain at home. When do you need to be alerted about a pain? And some of the tips that he's going to give are going to be very important. So we thought we'll start with pain this week. Next week, we have a dentist who's going to talk about oral hygienes. Right now, there are no dentist places that are open. So he's going to talk about simple tips for oral hygiene and to avoid going into an emergency situation. And then we're going to have like one of the doctors, Dr. Vasu, is going to talk about, psychological things. We're trying to confirm with him because right now he is a psychologist and he's very busy. If he is not in next Sunday, we'll have, another presenter come in. This is going to be the series for the next 1 month. All it takes is you guys to log in. This is completely free. You can share it with your friends. We're going to have speakers on nutrition. One of the speakers is going to be on improving your immune system. And a nutritionist is going to talk in first week of May. And we're going to also talk about breathing techniques right now, during the COVID period. Aditya Teja is going to talk about it in May. So I'm arranging all these speakers. Please log in and show your support. And, that'll be really helpful. This is only educational. There's nothing else involved in this.
Definitely. So I have a now, because of the COVID thing, everybody's at home and we are watching not of Netflix. Trying to see sitting and watching Netflix all the time. It sounds good, but we have to be practical, right?
Yes.
Anything you can help to make it practical and helpful will be appreciated.
Very good question. I didn't expect this question. Try to stand up. Once again, your alarm is the key. The first 3 weeks, the next 3 weeks that you're going to practice this is going to be the key. Try to stand up, standing up, or break that posture that you're sitting in. I know if you're going to be watching a movie, usually a movie length is like hour and a half. Try to stand up at least a couple times in between that. We are not watching it in a theater. Anybody can stand up. Maintain your sitting posture. Eye level is key when you're watching TV. Do not bend down. Try to avoid your phone if you're going to be watching there, because the minute the phone rings, you're going to be looking like this. Try to avoid it. If you can't avoid anything, get down to the floor, sit for 5 minutes with your legs crisscrossed. The best position to avoid any pain is you're sitting down on the floor with legs crisscrossed. I know nobody can do it after 5 minutes, but try to do that.
Yeah, I think that's helpful to have balance between like lying down and then doing something.
Sitting. Yeah, definitely break the posture.
Thank you.
And I have one more question. How do we choose a perfect pillow? The best way to choose your pillow is, once again, when you rest on it, make sure your neck is supported. It is not too firm. It is not too soft. As long as you can be comfortable on a pillow, do it. If you ask me what is the best pillow available, it is not your expensive pillow. The pillow from Walmart for $3 is much better. Just keep changing it every 3 to 6 months. So the $3 pillow can do the magic compared to all this My Pillow and everything that we invest on like $200. So
what about no pillow? That's
can you support your neck completely?
I guess not, unless you
so then the answer for me is going to be no. So I usually don't tell them not to use a pillow, but some people are comfortable doing that. As long as your neck is supported, that's all I care for. You can roll a towel if you want. Any other questions, guys? Like I said, please share it with your friends. What is going on is I'm recording this and I'm going to share it on the Facebook page under Weekend Wellness. So it'll be all shared there. So please share it with your friends. Let us help everybody to avoid going to ER or patient first or urgent care right now. Yeah, it's our responsibility for that. So let's do it.
Thank you, Ramki. That's what I was about to ask. Kindly share that video because I would like to share it to everybody.
Yes, yes, it's there, Rick. I've
Thanks,
put
buddy.
it up. Thank you. Awesome. Thank you. Thank you, everyone, for your time. If you have any questions, let me know. Otherwise, I'll go ahead and log off.
Thank you.
Terrific.
Thank you,
Thank
Ramki.
you.
Awesome.
Thank you. Thank you. Hey guys, before you log off, if anybody wants me to present this posture topic alone with your friends and colleagues, let me know during the weekday. It takes half an hour. I'm happy to present it. I'm happy to save everybody from going to the ER. So just call me, message me. I'll take care of it.
Thank you, Dr. Ramsey.
Thank you.
Thank you.
All right.
Thank
have
you.
a good evening. Stay
Have
safe.
a good evening. Thank you.
Thank you.
Bye.
Thanks.
Be safe, everyone.
Even.
Yeah.
Okay.
Yeah.
Okay, you